Good afternoon. Welcome to the YWCA's Talk on Health. The Talk on Health was a project created in collaboration with the Lower Cape Fear YWCA and the Wilmington Alumni Chapter of Delta Sigma Theta Incorporated. This project was created to reach the surrounding community and give them an opportunity to ask questions of healthcare providers that they would not normally be able to ask in a more relaxed setting. We invite you to add questions to the chat as you listen to us today. Today's topic is COVID-19, supporting women's health and well-being through economic opportunity and mental health. I will begin with a land acknowledgement from the YWCA, and then I will give our panelists an opportunity to introduce themselves. The YWCA of Lower Cape Fear serves the people located within the Lower Cape Fear region. This land once thrived with life from indigenous peoples, known today as the Cape Fear Indians and the Waccamaw Siouan Indian people. Living in settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of these places. Indigenous peoples are not just relics from the past. They are here, still continuing to demonstrate their talents and gifts amidst the backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity in Native nations. Thank you very much. We will begin today by introducing our panelists and allowing them to tell us why they're here and what expertise they bring to the table today. We'll start with Brittaney Bethea.
Thank you, Dr. Jarrett. Hi, everyone. My name is Brittaney Bethea, and I'm joining you today from Atlanta, Georgia. I am a health communication project director at a woman-owned firm called CommunicateHealth, and there I lead communication strategy for federal campaigns and initiatives. During the past 2 years during the pandemic, I was the former director of communications and dissemination for the National COVID-19 Resiliency Network, led at Morehouse School of Medicine, which was essentially a cooperative agreement funded by the U.S. Department of Human and Health Services, specifically in their Office of Minority Health. This effort was really to try to combine efforts of national organizations across the country to really consolidate the number of COVID-19 communication efforts so that they were more streamlined and effective for communities. Today, I am very excited to be joined by Dr. Angelica Geter and Dr. Bethea as we have a conversation today to hopefully share insights that help you and your families.
Okay, thank you very much. Now I'll give Dr. Angelica Geter an opportunity to introduce herself.
Oh, thank you for the opportunity to join this conversation. I've been looking forward to this discussion all week because I am happy to see some very familiar faces, happy to reconnect with everyone. Again, I'm Dr. Angelica Geter, Chief Strategy Officer of the Black Women's Health Imperative. And for nearly 2 years, I have had the privilege of launching the Fair Work Initiative, which focuses on transforming the workplace to protect and empower Black women. Prior to joining the Black Women's Health Imperative, I was the Chief Health Officer of Atlanta, leading the mayor's pandemic response team and coordinating efforts for the city of Atlanta. So I'm happy and looking forward to the discussion. I'm excited about connecting with everyone, and I will pass it back to you, Dr. Jarrett.
Thank you very much. And next we have Dr. Gigi Bastine. Could you please introduce yourself?
Sure. Thank you, Dr. Jarrett. Just really grateful and honored for the opportunity to be with you all this morning. My name is Gilbert, but I do go by Gigi Bastion. I am a clinical psychologist by training and faculty at the Morehouse School of Medicine in our Department of Psychiatry. And there we do work focused on mental health disparities, eliminating those disparities and helping communities that historically have had significant barriers to accessing mental health supports, to getting that care, but also getting that care in ways that are culturally appropriate and that represent the best quality care and services that we can provide to those communities. And so I'm really excited to be here to talk about mental health in particular and how it's been impacted by COVID. In addition to the work that I do at Morehouse, I also lead an initiative to promote wellness among Black women and women of color that I'm excited to sort of draw from as a part of this discussion about how we can continue to be and strive towards being our best mentally, even in the midst of times like these. So super excited to be here among a powerhouse of colleagues in health equity work, and looking forward to the discussion.
Thank you very much. Well, we'll start out with the big question. What impact did COVID-19, did the pandemic have on women's mental health? What have you seen in your practice and in your interactions?
Well, happy to get that started, and then would love to hear what my colleagues have to share. I don't think it will be a shock to any of us to hear that COVID has had a significant and tremendously adverse impact on our mental health as a community here in the US, but more broadly as a global community, right? I didn't speak to some of the work that I do outside of the US, but we have had, through our collaborations with partners in the Caribbean and in West Africa, an opportunity to hear about really the breadth and the reach of the impact of this mammoth of an opponent that we've been contending with in the way of COVID. And there are a number of ways that we could think about this, right? So there was the immediate sort of the early stages of this pandemic, when we were all trying to just come to grips with us being in this kind of lockdown mode. Everything that we knew about life as normal was kind of flipped on its head. We had to sort of hunker down. Quarantine became a word that even our 4- or 5-year-olds were uttering, right? And so there was a lot of disruption to routine and to normalcy that had some very immediate effects on our state of mental wellness and functioning, right? We take for granted sometimes how much we are creatures of habit as human beings. We rely considerably on routine and systems and processes. And so when those things get disrupted, that at a minimum creates angst and psychic sort of unease for us. So we certainly saw those things, what we would call sort of subclinical, not quite at a level to diagnose, but just sort of stress that we were seeing across the board, right, in our communities. But then as we continue to have to now deal with what this new reality, this new normal of COVID meant for us, of being at home, not being able to do the things that are often connected to our sense of purpose in the way of work, not being able to connect and convene with community in the ways that we are used to and accustomed to. We really then started to see some of the things that move us closer to diagnosable challenges, right? Diagnosable levels of stress and distress, of anxiety. And we have, over the past 2+ years, seen really an explosive increase in depression in the US and around the world, and anxiety, in things like substance use. Alcohol use has skyrocketed. We are absolutely in the midst of a mental health crisis when it comes to our young people and the youth in this country. We have seen really alarming levels of increase in suicidal thoughts and behavior within that particular population of our young folks. And so it's been a complex picture, and as if that weren't enough to sort of deal with and wrap our hands around, we know COVID has not been happening in a vacuum, right? We've had a lot of other things happening at the same time, contending with the stirring of the racial history and tensions in this country, right? Watching what happened with George Floyd and the sort of aftermath of all of that for our community, the economic sort of challenges that have come along with COVID. And so all of those things, I would say, have challenged our communities in some really significant ways. And the burden of that impact, we see disproportionately for communities of color. We see disproportionately for women who were dealing with all these challenges for ourselves, but also every other space that we take on additional responsibility of maintaining families, of leading community, of leading various initiatives. And so we saw sort of a double burden, I think, for particular groups around these challenges. So it has absolutely been a challenging time from a mental health standpoint.
Yeah, and I'd add that, women are more likely to help with personal care. They're devoting more hours of care each week to their families. They're spending more years over their lifetime giving care, and ultimately they perform more care-like tasks compared to men. So, we all know and can experience how caregiving experiences are rewarding, and it's a lot of time how we show our love and appreciation for others, but there's definitely no question that it really can be stressful and have a negative physical and mental health consequence for women in particular.
For sure.
So a couple of things that crossed my mind as both of my colleagues were talking, it made me think about the fact that about 47% of Black women during the earliest stages of COVID could not stay home. They had to continue to work. They had to really risk their lives in the midst of a time when there was no vaccine available, certain resources weren't available, and really kind of faced with the choice and the decision that they had to make as whether they would be able to provide for their families and their safety. And the anxiety that's associated with that has continued to plague so many women who were in that position, even after PPE, vaccine, and all these other resources have been developed. So then when you make that connection between this very specific group of Black women who could not stay home, who's constantly risking their lives, and then understanding that they are being paid far less than any one other groups. During that time, Black women were being paid 63 cents for every one, they were earning 63 cents for every $1 a white man earns. And now we earn 58 cents. And when we think about Black women's equal pay day and the shift that's happening as it relates to the stress that's associated with being able to care for your family, the long-term impact and effects that that's having on Black women, knowing that those stressors don't stay at work or in the office or wherever you are, we take it home. So the stress of a Black woman and the impact it has on her family, her community, and everyone she's connected with, I honestly don't believe that we have begun to scratch the surface of the trauma that's associated with the COVID-19 pandemic, let alone the long-term effects of racism and gender discrimination that Black women have been experiencing for over 400 years. There's so many layers to this conversation for us to consider and to build upon, but those were a few of the things that crossed my mind as we were starting the conversation.
Yeah, if I can add one piece, and absolutely agree and think that's spot on in terms of the key themes that you point out. And one of the pieces that we're starting to see in terms of what will be an ongoing sort of narrative around the mental health consequences and fallout of COVID is this issue of sort of residual sort of trauma, but also the grief, right? The ongoing sort of legacy and impact of grief. We saw losses of all kinds in this period, right? The loss of our sense of normalcy, of what it meant to be who we are and the activities that sort of shape up that view that we have of ourselves and the identity, but also real and actual loss of lives. A lot of members of our communities were lost in that time, and each of those people were embedded in their own village and networks. And so that brings an impact for those circles of folks as well. So grief has been a huge, huge challenge in this time. And then also wanted to point to the issue of not only sort of new mental health challenges that COVID sort of provoked and instigated, but the exacerbation of pre-existing mental health challenges, right? So as someone who has been in this field for a number of years, we were already dealing with significant challenges around mental health as a global society. And COVID just really ramped those up now to lead us to where we're sitting now in terms of a mental health crisis that has literally been acknowledged as such by the World Health Organization. And so we have work to do in this area.
Yeah, I thought about the things that you all said, and when Black women were forced to go back to work early, a lot of them were in environments where people were not wearing masks. It was and they would come into, I'm a family medicine physician, so they would come to see me and very stressed out and, wanting to know whether they should continue to go to work or do they need to quit their job. And not only that, they were leaving home and leaving their children at home to learn on their own, and they were getting behind so that they can go and do these jobs that they weren't well compensated for. So yes, there were so many aspects of COVID and how it affected women's health. We could probably just talk about that for an hour or more, but let's move on to the next question. What are some tips and guidance for women wanting to improve their mental health?
I'll get us going. I think there are a few ways to kind of think about this. So in my colleagues in public health talk about how much more bang we get for our buck on the preventive side, as opposed to having to intervene once we're already in trouble, right? And so I think really thinking proactively about what we can do to maintain mental fitness, if that's where we are, or to stave off the waves of mental health challenges is an important strategy, right? And one way to do that is really getting attuned to ourselves, right? Knowing when we see shifts in our norm, right? If we're catching ourselves kind of responding and reacting to the people around us in ways that, like, that's not like me. This interaction, this exchange I just had with my colleague, that's not my usual vibe, my energy, like what's that about? So starting to early on catch those indicators that there's a shift in our mood and our typical sort of behavior, I think matters. But at a community sort of level, I think exactly what we're doing today becomes an important part of a prevention in kind of normalizing these conversations to try to get us beyond a lot of the really deeply entrenched stigma that can be a real barrier for seeing us move further along in the mental wellness that we could have as a community. And so I think creating space for this kind of dialogue and acknowledging that we do have days where we're not 100%, and it's okay to acknowledge that, and to be a resource for one another also goes, a significant way in terms of helping us to think about mental wellness. And what I try to emphasize in the work that I do, I think it's so easy, especially when you're thinking about something like COVID, where everything about it was alarm bells and emergency. That sort of disease, disaster, dysfunction kind of narrative can be really overpowering. But always there's the other side of the coin. Always there's resilience, always there's strengths, always there are assets that we can leverage, whether we're looking at that individually, what are the things that I do well and that are going well for me and that I can think about even maybe from like a gratitude perspective. But at the level of community, we could go on all day about what's wrong and what the challenges are in the communities that we serve, but shifting from asking what's wrong in the community to looking for what's strong in these communities, right? What do they do well? What are the assets that we can leverage and use as tools for our recovery becomes really important. So that's what I would speak to on the prevention side. But then there are those times where things in terms of our mental health functioning start to suggest we need reinforcements. We've now reached a point where the challenge is beyond what I can manage as an individual, what we can manage as a family. We need to now pull in additional supports and reinforcements. And I think knowing what the signs are to clue us into that becomes really important, right? So knowing that when we start to see ourselves getting in a pattern of neglecting responsibilities that are really important for us, right? We're not showing up at work in the way that we would want to, or in a way that matches our standard. We're not moving in our family space in the way that we typically might. If we start to catch ourselves engaging in risky behaviors, drinking, excessive substance use, violence and aggression, those are often clues that, okay, I'm getting to a space where the weight of the stressors are beyond what I can manage on my own. And certainly when we start to see really increased tension in our really meaningful and important social relationships, right? If the kids are telling you, Ma, you're not, like, what is this energy from you? That can often be a sign that we now need to ramp up to another level of intervention, which may look like, initially speaking, to trusted contacts in our networks, maybe faith leader, friends, family who we trust, but often it may mean looking to therapists, to specialists, trained specialists in mental health to help us to develop a plan and a strategy for moving beyond those periods of challenge. And then there are times at which we're in a crisis situation, right? Where there's not the time to sort of thoughtfully develop a plan, but there's actual danger of harm to self or harm to those around us, where fortunately we have some resources available to us. You all may have heard about this new mental health crisis line, 988, that we now have as a resource. Just as if, the house is burning down, we have an emergency, we pick up the phone and call 911. If we or our loved ones are in the middle of a mental health crisis, we now have this 988 resource that can allow us to access some immediate supports. We are right now in the middle of Suicide Prevention and Suicide Awareness Month, right? So that I'd be remiss not to mention that that's often where unmanaged and the things that we don't sort of intervene on early enough can take us to a place where we think about not being here anymore. And so the National Suicide Hotline, I think, is an important resource, 1-800-273-TALK, right? And for communities of color, there's an important kind of intersection between culture and mental health that I think is important, right? Because we can overcome folks not being comfortable asking for help, we can overcome stigma, but if when they make that attempt to get help, they're not getting help that speaks to them and can understand them from a cultural perspective, we're missing the mark. We're not doing what we can there. And so I think knowing what the resources are within our communities becomes really important. So therapy for Black girls, for example, is a resource. They house on the therapyforblackgirls.com website a directory that helps you to find therapists of color around the nation who in particular have an interest in working with Black folks and minoritized communities. And so I think having those resources to help us move from prevention to where there may be actually a need for immediate and direct intervention becomes really important for us to think about.
Yeah, I think that those are good. You covered at least 3 things that had crossed my mind. So thank you for that. I think there are a couple of things that I would add to that as it relates to resources. Therapy for Black Girls is a great website. The Black Women's Health Imperative website, bwhi.org, has a stress test that you can just type in the search link, stress test, and you can go through, answer questions, and really understand where you are. In January, well, really prior to then, we have an ebook that's going to be available through the Fair Work Initiative, through our Art for Wellness toolkit that provides Black women with tangible information and resources about their physical, mental, and emotional health. We have playlists, we have a lot of click and play resources that through this ebook that will be available through, yes, thank you, my team is on it, that will be available through the fairwork.bwhi.org website. So with this initiative, we're really focused on systems level change, but we know that Black women need resources right now. Our state of mental health is in flux. There's so many triggers that have been established or reignited because of this global emergency that we are living and operating in, trying to thrive in. But we need some tangible tools and resources, language, things that speaks to our experience that we can grab onto and get a hold of. So Art for Wellness is a toolkit that Black women will be able to tap into through the Fair Work Initiative.
Yeah, I echo what my colleagues have mentioned. I think that for me, I always think about access as a major contributor to mental health, but also broadly more to physical health as well. And if you're someone in the audience who feels like you don't have access to a physician or a therapist, I think one of the themes that came out of the conversation is really this self-awareness and being in tune with self. There are small things that individuals could do every day that really do make a difference. And it might be something like taking a walk or eating a more healthier diet. Just really making time for yourself, even if it's carving out just 30 minutes a day, reaching out to friends, keeping humor in your life, and just keeping some level of routine, even if it's that 30 minutes in your day, or if it's a medical appointment that you do have. And also just trying to think more positive, reflecting on the things that you're grateful for, the things that you do have in your life. Those things can make a big difference, even though they are small.
Yeah. And this is one thing I do want to add to a part of this discussion. Very oftentimes, especially for us, we have this push through mentality where we're just trying to push our way through whatever may be going on. We recently conducted a study with about 4,000 Black women across the country. And we also had some one-on-one interviews, and we talked to them about how they're coping during this time and asked them for some very specific solutions on what employers can do, what they can also do to invest in their own self-care, how they are coping. And the spiritual aspect of wellness came up. It was a consistent theme within those discussions, thinking about having healthy boundaries and then being okay with not being okay, and making the decision to no longer try to push through during those moments. It was, for our team, invaluable because we were creating safe spaces for Black women to have that conversation. I know Gigi mentioned even this sense of community, but having those safe spaces to just be like, I'm not okay, and I may not be ready to talk about it, and I can pause. I think having those boundaries for ourselves and creating that safe space for other people when we are okay and are emotionally having our cup full as well, being able to do that for other people is so intentional. I think that's important for us to be able to say that out loud, that we don't have to keep pushing through these moments.
So true.
Thank you all. I definitely got some tips and pointers and some websites that I can point my patients to. I look forward to that because it really is difficult to find therapy for people. I'm sure that you all spoke to that. One thing that I do sometimes, if it relates to work, is point them to the IEP program, which almost every job has. That gives them the opportunity to have like 3 free treatments. And then you don't have to worry about the money as much at the beginning. But now we have all of these other websites that I can direct them to also. And thank you, Brittaney, for mentioning health, because, as a medical physician, we were talking about things that you can do to help with mental health, and definitely taking a walk, eating healthy, and just taking care of your general health care helps with your mental health care as well. They partner together, of course. How can women support each other in creating environments where those that are affected by adversity can move?
Yeah, I was thinking a lot about that as I was listening to Dr. Geter speak about that community sort of element, right? That has so much to do with what went wrong during these COVID times, was that loss of community. And in some ways, I think certain communities feel the burden of that more when so much of personhood is kind of embedded in community and in families. And so on the other side, then what that tells us is that often the key or the catalyst to healing sits in community. And Brittaney and Dr. Geter know that one of the things recently I've started to work on is around creating spaces of health, of wellness for Black women that really focuses on retreats and travel as a vehicle for accessing healing spaces and stepping into those spaces in community as Black women. And part of what led me there, after 10 plus years of doing work on an individual basis as a psychotherapist, is the realization that there's some real limits as to the work that we can do as health professionals in that sort of one-on-one individual level point of intervention. And I have seen some really powerful things happen in terms of communal healing when groups of women come together. There, Dr. Joy Harden Bradford, who leads that Therapy for Black Girls initiative that I referenced, is writing, or maybe has now already released, a book that she's been working on called Sisterhood Heals. And it speaks to really this potential for healing that happens when we can come into those spaces and move past that need to sort of put on and perform and to be A game. I talk in my wellness work about my sort of target and key demographic being recovering super women, right? And when I'm speaking to those women, I'm preaching to myself, because we know what it is to be the go-to in our families and the go-to at work, who's leading this and leading that. And we wear a million hats and we have our hands in all the things. And we have to then be really intentional about creating spaces to be, creating spaces to pour in, creating spaces to cultivate and nurture those things that help us to show up as our best selves. And so my work in that space has really been through the work that I do under my company, Ubuntu Healing and Wellness Journeys, to create opportunities for convening, for bringing women together, and doing that away from the US and all the challenges that sit here often, to really get in new terrain and to come to some stillness and to hear and learn from each other about how we walk out wellness in the smallest ways in our day-to-day lives. So I really think there's an important opportunity for us in community to help support one another's healing and wellness.
Yeah, I think much of my work really centers around how do we help facilitate positive behavior changes. And I think to answer your question around what can other women do, it's really that social support from friends and family. And that can look like a lot of different things, like offering encouragement, making new connections, reaching out to someone maybe you pass in the hallway, but you've never spoken to, or helping to be someone's accountability partner, or even modeling something that you feel like might be helpful to someone else. Like all of those different behaviors really help someone else improve their lifestyle, and can be a support system to them.
In addition to those things, and I think because I keep receiving the opportunity to be in these spaces, these safe spaces for Black women to really invest in their own self-care. And one thing that I'm realizing, and I love what you said about recovering superwomen and taking care of ourselves in a time when so many of us have been pouring so much into other people. I think the first part of the discussion that really focused on this awareness of self and self-actualization, understanding what we need and what we don't need, having those healthy boundaries. I can't say it enough, because what tends to happen is that when you are someone who is emotionally healthy, and I use air quotes simply because we define that for ourselves, right? When people feel that energy, when people are around us, people want to experience more and more and more of that. And people can tug at you, and you have to make sure that your cup is full. You have to make sure that you're investing in your own health and wellness. And so understanding where your limits are as you're pouring into other people, having those boundaries for yourself, understanding what you need. I don't think we can reiterate that enough when it comes to Black women, especially.
Thank you. I just keep hearing strong Black women. I mean, that is a statement that is made too many times, but I also think that it's strong to be vulnerable, and it is strong to get the help that you need.
Absolutely.
Absolutely. Absolutely.
How does access to economic opportunity influence women's health?
I'll kick us off with this one. So with Black Women's Equal Pay Day, our entire team was ready to launch our initiative, share headlines and all this other stuff that we had laid out for August 3rd. And then the reality set in that Black Women's Equal Pay Day had been pushed back to September 21st. And what that really means is that Black women are working more days further into the years. Really, I think it's around 263 days, additional days, to earn an annual salary. And when comparing to white men, part of the problem with that is that it makes me think about the encounters that Black women have with racism and discrimination in the workplace. the missed economic opportunities that we have when it comes to investing in our community, our family, small businesses, and even in this country as it relates to real estate and other opportunities. It makes me think about the student loans that we know for a fact Black women have some of the highest student loan debt in the United States, with limited opportunities and resources to actually have their loans forgiven, let alone understanding the process that you need to go to get those resources. It makes me think about the stressors that Black women are facing. And part of the reason why we created this initiative is because we know for a fact that the long-term impact of stress, the chronic stress based on racism, discrimination, lack of economic resources to protect and empower your family, with the understanding that Black women tend to be the heads of their household and the primary breadwinner. We know that it's impacting our mental health, our physical health, the cortisol levels, since we can have a whole session on cortisol and how it makes it difficult for us to lose weight, decrease our stress levels, impact heart disease. Dr. Geter is like, absolutely. All of this is connected. And I think for us, even understanding that experiencing racism, economic turmoil, different variations and experiences of poverty, regardless of where you are from, it shouldn't be our normal, and it's all interconnected with our health and our state of being. And half of the time, it's a tradition that is passed on over and over again. And Black women aren't making that connection between what they experience at work, their limited access to certain resources, and how it's impacting their health. And so when we talk about how does access to economic opportunity influence a woman's health, it impacts her life from start to finish before she's even born. And so we have to really think about the full lifespan of Black women and how economic empowerment can support them and protect them throughout their entire lives. We haven't even started talking about the millions of dollars that we miss out on when it comes to economic inopportunity and pay inequality. So I want us to start thinking about money in a way that is very tangible and very real and directly connected to our physical, mental, and emotional health and spiritual health as well. The other thing that I really want Black women to think about is that the resources and opportunities that we have when it comes to the economic impact and really, again, resources that are out there, it isn't far-fetched for you to have a financial advisor. It isn't an unrealistic opportunity for you to be able to invest. It is an unrealistic opportunity for you to buy a home. There are so many resources available for Black women, and all of these things could help to improve your health. Even just getting a budget and knowing where your dollars are going can relieve the stress that's associated with lack of economic resources, and you can regain that control. And again, that's part of the reason why we created the Fair Work Initiative, part of the reason why the Black Women's Health Imperative has existed for nearly 40 years, because it's so important to help Black women understand why financial resources are directly connected to your wellness.
Would anyone like to add anything else to that? I think she pretty much covered it.
Yeah, I mean, I would just there's a direct relationship between economics and health. I mean, if you have more access to economic opportunity, you're more likely to be able to afford a healthier lifestyle. And those who, have lower economic status, they're more at risk for increased risk of heart disease, stroke, cancer, diabetes. And so ultimately investing in women's health, investing in their economic health, I should say, it leads to more positive health outcomes for them overall, as well as extending to their families.
Yeah, I would echo all of that. And certainly I think the clearest space that I see that connection between health and money is often in the work that I do outside of the US, right? And what we consider these lower resource parts of the world where as health and public health professionals, we might hear of a, disaster, which is where some of my work sits as well. And folks think, let's get the doctors down there and let's get the medical supplies in and out, but they're growing studies that have demonstrated that sometimes the interventions that literally are dollars and cents being funneled and fueled into these affected communities, disaster affected communities, are the things that end up driving the very health outcomes that we're chasing. It turns out people can do better about tending to their health when they're not wondering where their next meal is coming from. So I definitely would echo what has been shared. And I would also add that there's an important sort of money power connection that has implications for health, right? Finances, for better or for worse, in our world, in our society, has everything to do with power and disempowerment, right? And so in facilitating some of the things that Dr. Geter talked about in terms of financial literacy and education, it's an empowerment agenda that gives us a level of control and agency over our lives that I think can be really, really powerful and important. And so in my work from the mental health space, I almost am increasing in the way that I'm encouraging folks to think about finances, financial education, financial literacy as self-care, as a form of self-care. It is a way that we tend to our wellness, is by looking for ways to empower, looking for ways to provide ourselves the tools that we need to be able to take control of and manage this piece of our lives that has implications for just about everything we might want to do. And so there's absolutely an important connection there.
Dr. Geter, can you expound on Black Women's Equal Pay Day on September 21st and tell us what we can do to support it, or if there's anything that we can do, or what are we supposed to be doing that day? Am I supposed to go meet with my boss and tell them that they need to pay me on that day?
I wish that Black women, listen, I wish Black women around the world would be able to go out and be like, can we meet at 9:15 so we can talk about Black Women's Equal Pay Day and how Black women are only being paid 58 cents to the dollar of white men? I think that there are a couple of things that I really want people to do to start following us at, I think it's Black Women's Health on all social media platforms, or just search the Black Women's Health Imperative. Our team has developed a toolkit for Black Women's Equal Pay Day. We can share that with everyone on this call. What we really want to do is promote awareness about, for one, the fact that now Black women are being paid less, and also the impact that it's having on our health, the resources that are available out there. We want people to share their stories and to really talk about what's happening to them in the workplace and how equitable pay could really support and empower their dreams and their families and their communities. And so go to our website, download that toolkit, follow us online, start that conversation, message us, because our team is very responsive, especially on IG. We are very, very, very interested in hearing from Black women across the world, because we have been given the charge from Angela Davis herself to think global in this work. It's so important for us to move beyond just thinking about what's happening to women here in the United States and really promoting global change and really thinking about systems level impact and change. And so that is what you can do. Have those conversations, understand where you stand as it relates to your finances, identify a couple of resources. We have some on our website about financial wellness, a few articles. I think we can also identify a list of financial wellness coaches that will be coming out through the Artful Wellness ebook as well. We're rolling that out in different phases, and there'll be a big chapter on financial wellness, so stay connected to us. The other thing that I would say is that operate with a sense of power and understanding that you are in control of your finances and that you can have what it is that you want, but you need a plan to get there. And there are multiple resources out for women who do have power, because there are some women who do not have power as it relates to their finances for various unhealthy reasons and unhealthy relationships. But for women who feel as if they can't operate with some autonomy when it comes to their finances, there is a way to take control, and there are resources out there available to assist you. For women who don't feel as if they have that autonomy, there are also additional resources out there to assist those women as well. And so that is what you can do. And thank you for bringing that up. I'm so excited that we can share the toolkit and that people can get the message out there and talk about Black Women's Equal Pay Day.
I'm sorry. Thank you. I'm very excited about that too. This might be a redundant question, but what financial steps can women take as they continue to navigate the gender pay gap, the rising cost of living, and projected economic recession? Specific things that we can do.
Start with a budget. I told you I've been thinking about this all week. That was the very first thing that crossed my mind. I remember when I was a postdoctoral fellow, I wasn't paid very much, didn't have a lot of money, was trying to get a whole lot of experience. And I was blessed by one of my mentors to be introduced to a financial advisor. And I said the exact same thing to her. I said, listen, I don't have a lot of money, but I know where I'm trying to go in my career. I want to know how to manage my money. I want to know how to get there. There are some simple, before I even was connected to her, I just went to Excel and downloaded a budget template and just started putting in my finances and just started taking note of what was happening with my money and where it was going. And then I went online and just started Googling a couple of financial wellness coaches that were reputable, talked to my network, spoke with my mentors, connected with people in my community and asking them questions about financial resources. I identified a person who was managing their money and investing their money in ways that align with my goals and my passions and my interests. And I just took a chance to ask them the question about how do I do that and where do I begin? I am the first Black woman in my family. I'm from Jackson, Mississippi. First Black woman in my family to earn her doctorate. My mother was the first Black woman. Well, most people are Black in my family, but first woman in my family to earn her master's degree. And so being the first generation to really build wealth beyond anything anyone else in my family has seen was something that was very new for me. And we've talked about mental health that's associated with that, and the remorse sometimes is associated with that, learning to break certain habits as well. The tangible thing that I would say is start with a budget. Identify someone who could assist you with your finances. Go online and search for tangible templates and resources. Think about where it is that you want to go and start working towards a plan to get there. You don't have to have it all figured out right away, and it takes time. So I would also say be patient with yourself.
Thank you very much.
Absolutely. And amen to all of those things. And I mean, I wish I could say for where I am in my career that I were like rocking and rolling in this arena and had my systems all worked out. But the unfortunate common reality in our community is that we're having to school up in these adulting years on financial literacy and how to be good stewards of the resources that we have. And so absolutely, I would agree with Dr. Geter in terms of getting those tools, starting simple with knowing where your dollars are going, right? You can't intervene on what you can't see. So let's see it. Let's track it. What is it that's happening with the dollars coming out of my account? It's certainly something I've had to work on. But also what comes to mind as I think about this question is the opportunity that we have to think expansively about our earning power. And I think that's something women and Black women in particular, you know, for understandable reasons, don't often have the luxury and the mental bandwidth to even sit and strategize and think this way. But we leave a lot of potential earning opportunities on the table often because we're so busy being all the things to everybody and are contributing to agencies and organizations that we work for, sort of building themselves. But there are real opportunities to look at where our passions are, where our giftings are, and to see how we might find in that some opportunities to move ourselves along financially. And so that I think is an important thing to think about, if we can do it on our own, or if that's something that means finding a coach to help us, investing in things like coaching, investing in things like personal development, and sitting with people who can help us to think about what is that thing that you could just sit and do all day. And how do we think about that in a strategic way? And even for those of us who've been trained in different specialty and professional arenas, we've been so trained in siloed ways that sometimes we think, I'm trained as a psychologist, I go out here and do psychologist things. And I had to have someone sit with me and think, okay, well, if trauma is like your jam, and that's what you do, trauma and resilience, there are things that you do in a particular way in this space that could feed into a book that could serve someone, that could be a part of an e-series that could teach someone, that could be a part of a speakership kind of. There's so many ways to take and funnel out the things that we have as expertise or talents that can help to increase our earning potential and to put us in a different space. And that I also think is a part of this empowerment angle, where we're not just having that conversation with the boss on the 21st, but maybe the way I'll celebrate on the 21st is to think about what's an opportunity for another stream of income that I can sort of create for myself that's not dependent on someone else's sort of stamp of approval. So that would be my 2 cents in that piece.
I love it.
Yeah, same. Same. I agree.
I'd also like to add estate planning as something that we as Black people should think about. And like you said, when you saw the financial advisor, you said, well, I don't have much money. Whatever you have needs to be accounted for in your will. And even, I think we're all young women, we need to have wills, because anything could happen at any time. And we want to make sure that we're passing things on the way that we would like for them to be passed on.
Yeah.
Sure.
There's one thing that, going back to what Dr. Bastian just said, she really hit on what was crossing my mind, because I thought about, even with my work at the Black Women's Health Imperative, I have the privilege of leading the Fair Work Initiative, but I miss research, I miss data analysis, I miss guest speaking opportunities, I miss community engagement. And that's part of the reason why I created my consultancy, and I created these opportunities for myself to really tap into the resources and experiences that I love that extend even further beyond my work at BWHI. And so I think always having multiple streams of income is so important. I think having a backup plan when you can. And I think for Black women, we totally underestimate the value of even the smallest thing that we do on the day-to-day. One business course that I took talked about things that you love to do, and how you could easily turn that into an ebook or a small business, or just start charging people your rate to do that, because you're going to spend the time doing it anyway. Why not turn it into a business and collect the additional coins to help you reach your goals? So I think we have to have more of that conversation about how do we turn our loves and passions into an opportunity to build up our financial wellness.
If there are any corporate executives listening today, what can they do to promote equitable and fair policies and practices in the workplace that support all women?
Listen to Black women. And the part of the reason why I say, even though the question aligned with focusing on all women, the reality is that Black women tend to be left behind in the workforce. Black and brown women, women of color in general, tend to be left behind. So listening to those women and understanding those experiences, partnering with the Black Women's Health Imperative and the Fair Work Initiative, what we have done was create a web-based tool for executive leaders to measure those policies and practices post their DEI commitments and dollars and donations and strategies that they put out there. They need to know, is it working and is it effective? So working with the Black Women's Health Imperative, using our Fair Work Initiative Index, partnering with us to create a long-term strategy to promote wellness in the workplace, it's exactly what executive leaders can do. It isn't enough to make a DEI commitment or implement an annual training or just do it on a quarterly basis. You need a long-term strategy and a measurable resource to tell you where you need to put your efforts and where your dollars need to go. So listen, create diversity beyond just race, but gender, birthplace, so many other ways in which you can measure and think about diversity. Because one thing that I've consistently said to people is that everyone, if you look around your virtual table or the people who are in the room with you, and everyone looks like you, then your impact is always going to be limited. And the innovation for what you want to do will always be stifled. And so if you don't have a strategy, if you aren't measuring your impact, if you aren't including multiple groups to be a part of the discussion, then what are we doing? So working with the Black Women's Health Imperative, focusing on the Fair Work Initiative is something that executive leaders can do.
One thing that I would recommend that I've seen, begin to work very successfully is for organizations and executives to really have systematic approaches to listening to Black women. And so one thing I've seen is employee resource groups where individuals are able to really have that safe space in their organization to really surface some of their experiences and their ideas and their perspectives. But having a individual, from either your HR department or employee experience departments really be a liaison to the executives to turn those perspectives into action items, which is ultimately policy in the workplace. And then another thing that I have heard from colleagues and resonate myself is that when you have DEI places and spaces in your organizations, not to rely solely on Black women to train or facilitate conversations, especially around white supremacy or diversity, equity, inclusion. It is not our burden to educate. And so we are learning alongside our colleagues, but it shouldn't be our role solely to educate the company. And so I think really investing in outside facilitators, ensuring that people of color have an option to participate. I think those are key strategies for ensuring that DEI work is effective.
Thank you for saying that, Brittaney. I feel like a lot of times we are expected to carry out that work, and that is a whole job. And when you all were talking about multiple streams of income, someone should definitely get paid for that. And it also adds stress and causes more of the mental health issues that we were thinking about when you have to be the person who is attacked and the person who is trying to fix the problem. So yeah, thank you for saying that.
One thing that I would like to make sure I add is that the commitment to shift any workplace and make it healthier has to come from the top down. So executive leaders have to make a real long-term financial commitment to shifting how and what Black women in particular experience at work. And then in addition to not leaning on us to do all of the work and creating those safe spaces, also giving their full support. What we consistently see is that Black people in general are assigned and appointed to these roles, but they aren't given the full support that they need to actually execute what they have been, the job that they've been given to do. So I think it's important for that autonomy and support to be there as well.
All right, everyone, we're running out of time. I'd like for everyone to give a 1-minute statement that you would like to leave with the community. It's something to focus on and practice from our conversation. We'll start with Brittaney.
Oh man, I think I would recommend to really take it a day at a time. Like I mentioned earlier on, women in particular tend to have this caregiving role that sometimes even seeps over into the workplace. So we're doing it at home, we're doing it at work, and really just taking that time to be more self-aware of what we need, what we want, what fills us up, what drains us, what our goals are. I think that's really something that I would hope that everyone listening in today can just carve out some of that time to do for themselves.
Dr. Geter.
I've given all my plugs, so I don't have to give those. What I will say is rest. You don't have to earn rest because you exist, because you are here living, breathing. You you can rest when you need to. I think that is so important for all of these things and topics that we've discussed. Rest adds value to every part of our conversation today. And so invest in your health by allowing yourself to rest and listen to yourself to understand what it is that you need.
Gigi.
So good. I'm like writing stuff down myself. I would echo what my colleagues have shared and just re-emphasize the point about community and the resource that it can be for being our best selves, right? We are communal beings. There's a reason why isolation in the prison setting is like the worst sort of punishment we can give folks. We are the kind of animal that does not do well in isolation. And so I would encourage folks to be intentional about cultivating not just any community, but communities that will foster and move forward your well-being and your best self. And that's the work that we do with my company, Ubuntu Healing and Wellness Journey. The very name of it, Ubuntu, is very intentional. It comes from an African philosophy that basically translates to I am because we are, right? My humanity is intricately embedded in the collective humanity. And so I would just encourage folks to find those opportunities to connect with like-minded folks who can help us to really supercharge our efforts to be our best in our physical and our mental wellness. So I will, since I have not plugged well, drop my IG handle in here for anyone who's interested in learning more about what we do at Ubuntu Healing and Wellness.
Well, thank you all so much. This has been a learning experience for me. I think that I have gained some resources. I hope that you have also. And we have things that we can take back to all of our prospective communities. So thank you so much.
Thank you for the
Thank
opportunity.
you.
Thank you for having us.
So have a bye-bye.
You well,
Bye.
everyone.